Hello, welcome back to Unified OSCE. A big congratulations to all latest UK registered nurses and for all candidates preparing for the OSCE exam. Wishing you all the best. In case you're coming across this channel for the first time, on Unified YouTube channel, we talk all about tips to help you in your OSCE journey. Yeah, if you get to be a member, please kindly press on the notification button and subscribe to this channel. For all viewers and subscribers at the moment, we want to say you are all amazing. Thank you for your support. Let's get back to business. Yeah, so we'll be having a look at the evidence-based practice. It is one of the station in Oski. It is a silent written station. The allotted time for the station is 10 minutes. You are likely to be tested on one of the 14 topic focus on evidence-based. It could be ankle sprain, autism spectrum disorder, which would be our topic focus for this video, bedside handing over, cervical screening, cranberry juice and urinary tract infection, dementia and music, diabetes, female myocardial infarction, fever in children, pressure ulcer prevention, restraint, saline type versus water, smoking cessation, and the last one, use of honey dressing for venous leg ulcer. You have the marking criteria, so you are to give your answers in bullet points based on the marking criteria. So on the screen, we have the marking criteria as regards autism spectrum disorder. So we need to follow the points as stated in the marking criteria. Now, what is expected of you? You will be given a summary of an evidence-based research findings. So this is just an excerpt from an article summary from PMC, and it's paraphrased just to help us with this topic. It says a study was carried out among healthcare professionals, and from the response, at least 50% of the respondents have an idea that autism spectrum disorder can be related with other health issues like anxiety, depression, gastrointestinal problems, schizophrenia, epilepsy, self-harm or injury. Learning disability were more common in autistic adults. However, greater than 20% lack the knowledge about related health issues that autistic adults suffer from. And the rest of the respondents do not have an idea of what autism spectrum disorder is all about. The study report states that adults who feel disregarded are less likely to seek help. And previously, before 2013, people previously diagnosed with Asperger's syndrome are affected by misconception that they may still have learning difficulties. However, this is not completely true. They may still have difficulties to process and understand information. And the study concluded that mental health support and treatments will help adults with autism spectrum disorder. It will help their overall well-being and reduce self-harm behavior. All health professionals may need additional training to communicate with people who have autism spectrum disorder. So you'll be given an article summary like this. So you to draw your answers, the relevance of your answers and points from the article summary. And you'll be given a sample scenario question. And that's the next thing. Let's use this as a sample guide. You are an adult working in the acute medical ward. Your patient, Leslie, was visited by her partner, Charlie. Charlie walked up to you, voicing his concern about his partner suffering from autism. He strongly believes Leslie should be reviewed by the mental health team as she sometimes displays self-harming behavior. No, this is Leslie concerns. So now let's have a look at the question. So you have an answer script. It says the topic is evidence-based practice, autism spectrum disorder, candidate documentation, candidate name. Please make sure you print your name in full. And the question is write the relevance of the findings of the research and explain to Charlie what advice you will give him. Now, based on the findings from this research, you need to address Charlie's concern about his partner and give your responses in bullet points. So that is what is expected of you. Now, my own sample answers in bullet points based on the marking criteria. If you want to give the summary of the article, you can do it in 2 sentences because the main bullet point is what will give you the needed mark. But I just summarize it in brief. The article summary focuses on lack of understanding about autism spectrum disorder among healthcare professionals. So my response in bullet point. The first point, I will explain to Charlie that healthcare professionals' poor knowledge and lack of understanding of autism spectrum disorder are likely to be a barrier to those people who have autism to access mental health support and treatment. The next point, I will inform Charlie that healthcare professionals may need additional training to communicate with people who have autism. This is from the summary findings. And the third point, I will explain to Charlie that people who feel disregarded by healthcare professionals are less likely to seek further help. And the fourth point, I will inform Charlie that in the past, before 2013, people previously diagnosed with Asperger's syndrome are affected by a misconception that they have learning disability. But this is not true, not completely true. However, they may still have difficulties with understanding and processing information. Now, there is a little difference between Asperger's syndrome and autism spectrum disorder. Now, it is believed that autism spectrum disorder is milder than Asperger's syndrome. So the next point, I will inform Charlie that mental health supports and treatment may help Leslie's overall well-being and reduce his self-harm behavior. And the conclusive part, this is very important. So based on the article summary you are given, make sure the conclusive part of that article summary, you write it word for word and make that your conclusive part as well. So my conclusive part based on this article summary, in conclusion, the article summary suggests that healthcare professionals need update training on how to offer help and how to access available mental health support services and available support groups. And that's all. It's simple. That's your evidence base. Thank you for tuning in. Wishing you all the best. If you find this useful, please click like. You are yet to subscribe, press on the subscription button and hope to see you again